my experience, the patient-dentist bond is very strong. I don't know many people who bounce around from dentist to dentist. So you tend to stay with the same office for years and where people are comfortable. When a patient asks a dentist about their teeth being straightened or some cosmetic changes they like with their teeth, it means that they trust that dentist. That means a lot. Currently, dentists have the opportunity to do clear aligners or other things to help that patient in their own office rather than referring it out. It's important for the office, the dentist's office, to mention to their patients that they offer this. If they don't mention it, the patient may say, you know, I don't like this, but if you mention, oh, we do this, then it opens up a conversation. If you're able to help 1 or 2 patients a week for a year, it's $100,000 in income. And without getting new patients, there's no need, they're coming to you. Patients will much more readily accept clear aligners compared with an implant or a crown because it's non-invasive. You slip something over your teeth. You get scanned, you slip something, there's no preparation. Clear aligners don't need any of that. There may be a little IPR, which is a little strip going back and forth between your teeth, no pain. So it's much more readily accepted. One of the objections we hear is that they've never done it before, but the bigger one is my referring orthodontist may be upset if I start using clear aligners in my practice. Well, in fact, the orthodontists really aren't upset because what you're doing is you're weeding out the simple cases. You're still referring them the complex cases, but because you're looking for ortho cases now, as you probably weren't before, you'll probably end up referring more cases, more complex cases to your referring orthodontist. If a dentist asks me how much time is involved, how much chair time is involved doing clear aligners, it probably adds up to the same amount as doing a crown. I'm talking about from start to finish with the clear aligners. Same time as doing a crown prep. So 45 minutes, an hour, that's nothing. I believe that patients will accept clear aligners from their dentist because that's the dentist they choose to go to for their dental health. If you refer them out, they don't know orthodontists. They don't go to orthodontists off the street. They come to their general dentist, and if a general dentist can help them, that's where they're going to stay. They trust the general dentist to take care of all their dental needs. What the office is doing is making impressions, sending them to us. We make the treatment plan. We send them the treatment plan for acceptance, and that's it. There's nothing else. Rowe's been doing this for years. We have the designers, we have the manufacturing in place. We can help you every step along the way.